Good afternoon, how are you feeling today?
我还好，只是有点担心结果。
I understand. We did a blood test, and your white blood cell count was higher than normal. We also did a bone marrow biopsy to confirm the diagnosis. I have your test results here, and I want to go over them with you. After reviewing the tests, it appears that you have chronic lymphocytic leukemia, also known as CLL.
这是什么意思？
Chronic lymphocytic leukemia is a type of cancer that affects the blood and bone marrow, where the body produces too many abnormal white blood cells.
我的病有多严重？
Yours is not considered severe at the moment. CLL progresses slowly in many cases, but it can also become more aggressive. Some people live with CLL for many years with proper treatment and monitoring. We will monitor your condition closely and start treatment when necessary.
这种病可以痊愈吗？
Right now, there isn't a cure, but there are treatments available to manage the disease. Many people with CLL live well with the condition for many years.
有什么治疗方法？
The treatment options depend on the stage of CLL and how it affects your body. We may use chemotherapy, targeted therapy, or immunotherapy. Based on your current condition, I would recommend starting with targeted therapy. It's a more effective treatment for cases like yours that are progressing slowly. We can also consider other options, like chemotherapy or immunotherapy, if necessary. We'll monitor your response to the treatment and adjust as needed.
这种治疗是如何进行的？
Targeted therapy works by focusing on specific molecules that contribute to the growth of cancer cells. It targets and blocks these molecules, which can stop the cancer cells from growing and spreading. This helps to slow down the progression of the disease without affecting healthy cells, as much as chemotherapy would.
我什么时候开始治疗？
We can start the targeted therapy as soon as next week. I'll have the nurse schedule your first appointment and we'll go over the details of the treatment plan.
有副作用吗？
Symptoms can include fatigue, swollen lymph nodes, unexplained weight loss, fever, or frequent infections.
我会掉头发吗？
Targeted therapy is generally less likely to cause hair loss compared to other treatments. It focuses on specific molecules involved in cancer growth and typically has fewer side effects, especially regarding hair loss. However, hair loss can still occur in some cases, depending on how the body responds to the treatment. Although hair loss is a possible side effect, it's important to focus on the effectiveness of the treatment. We'll work together to manage any side effects and ensure the best outcome for your health. I can also refer you to a specialist who can help you with wigs.
我需要多久来治疗一次？
The treatment is usually given in cycles. You will likely come in once every few weeks for an infusion, depending on how your body responds. We will adjust the frequency based on your progress and how well you tolerate the treatment.
在治疗期间，我还可以继续工作吗？我是一名单亲妈妈，我需要养活我的孩子。
Many people are able to continue working during targeted therapy, especially if the side effects are manageable. Of course, it depends on how you feel during the treatment. Some people may need to take time off, but we can work together to make sure you get the support you need.
我应该如何向家人解释呢？
It's important to be honest with them, and I can provide you with some information to help explain the diagnosis. Having their support will be important for your well-being.
我对未来有些担心，我的预后怎么样？
CLL can be managed effectively for many years, but it's important to remember that everyone's experience is different. With the right treatment, many people live full lives.
我是不是一辈子都要吃药？
It's possible. Some people with CLL take long-term medication to keep the disease under control. But we will always adjust the treatment as needed.
我需要做些什么生活方式上的改变吗？
It's important to stay active and maintain a healthy diet. You should also avoid exposure to infections, as your immune system may be weaker during treatment.
我应该做什么样的运动？我还能做瑜伽吗？我是全职瑜伽教练。
Light to moderate exercise is generally good for you, especially to help with fatigue and overall well-being. Yoga can be a great option, but we'll need to make sure you're not overexerting yourself. I suggest starting with gentler practice and listening to your body. We can adjust based on how you feel during treatment.
我不能停止工作，如果停止工作，我会面临财务困难，我需要养活我的孩子。
I understand how important it is to continue working, especially with your responsibilities. We will work together to ensure that the treatment and any side effects are manageable so that you can continue supporting your family. Additionally, I can refer you to a financial assistance program that can help cover some of the costs of your treatment. If you ever feel too tired or unwell, don't hesitate to let me know, and we can adjust the treatment plan as needed.
我的病情需要多频繁检查。
Initially, we'll need to check your condition more frequently, maybe every few weeks, especially to monitor your response to treatment. Once your condition stabilizes, the checkups may be spaced out to every few months. We'll adjust the frequency based on how well you're doing and how the treatment is progressing.
我是怎么得这个病的？
CLL is a type of cancer that doesn't have a clear, single cause. It's believed to be influenced by a combination of genetic and environmental factors. In most cases, there's no specific reason why it develops. However, age, family history, and exposure to certain chemicals may increase the risk.
会遗传给我的孩子吗？
The risk of passing CLL to your children is very low. While there can be a genetic component, most cases of CLL occur sporadically, meaning they don't run in families. However, if there is a strong family history of blood cancers, the risk may be slightly higher.
我的病会不会有机会进入缓解期？
Many people with CLL experience periods of remission where the disease is less active or undetectable. This is a good sign and can happen with treatment.
在治疗期间，我可以过正常的生活吗？
Many people with CLL are able to continue with their daily activities, including work and socializing, especially if the treatment is well tolerated. It's important to listen to your body and take breaks when needed, but with the right treatment, you can still live a fulfilling life.
在治疗期间，有没有饮食限制？
There aren't any strict dietary restrictions, but it's important to maintain a healthy, balanced diet to support your immune system. I would recommend avoiding raw or undercooked foods to reduce the risk of infections. I can refer you to a nutritionist if you'd like more specific advice.
好，
We'll schedule your next appointment in 2 weeks to start the treatment and monitor your progress. After that, we'll determine how often we need to see you based on your response to the therapy. Please wait here for my scheduler.
谢谢。